There is an article in this issue of Workers' World, a newspaper, about the scandal in the Veterans Administration health care. So I'm going to try not to repeat a lot of what's there, like maybe only for context, but also I would just like to say that even though there is an incredible shortfall of health care among veterans at these Veterans Administrative Hospitals, community centers, and clinics, there have been lots of gains, like there have been in the struggle in general in the country. And one gain in particular that I'm having a personal experience with is that that the Veterans Administration, as of March of 2013, has a protocol where veterans who are transgender, that is transitioning from men to women or from women to men, can actually go through the Veterans Administration to get medical care, to get the hormone treatments, and sometimes to get psychological or psychiatric help. And in particular, my experience is I have a lesbian endocrinologist. I came out to her first. Just kind of amazing that this can happen. Like most of the doctors that I see at the VA are women and of color. It's a particular, I think maybe New York could be different because there is a large struggle here in New York. It is very different here in so many different ways, which is not to say that that what's happening with veterans all over the country, I mean, as I said in the article, it's only an aspect. It's like, and I said it's the tip of the iceberg, but it is. It's a huge, it's only a sliver of the scandal that we are seeing in healthcare across the country. You know, it's, and I'll just I'll talk in particular. I wanted to cover just a couple of areas, and I don't want to go on for so long. It's like one is the health care for veterans who are actually veterans of combat. That's one aspect of I wanted to cover. Another is the huge disparities in health care in the United States, along the lines of like for people of color, for women and children, and for poor people and working people. And I think we know a poor person is not only an impoverished person. A poor person can make what they call the median wage and still not have sufficient income to live. And then I wanted to talk about, just like touch on the disparities in the southern United States. Then I wanted to compare these just a little bit with socialist Cuba. And I'll start by just saying that in the United States, almost $9,000 is spent per person on health care. And I think without even going into any detail, we all know the state of health care in the United States. We know about infant mortality. We know about the struggle for women's health. We know of all the cuts that are taking place in all the budgets for anything that has to do with health and human services. And so I'm not going to go into a whole lot of detail, but a tremendous amount of money, I mean to the tune of billions, if not trillions of dollars are spent every year on health care in the United States. In socialist Cuba, not even $450 is spent per person. And the healthcare system in socialist Cuba is held up to be one of the finest on the planet. It's lauded by all kinds of scientific organizations, the UN, etc. Disparities don't exist there as they do here. And I'll touch on that just a little bit. But first, just maybe discuss a little bit about veterans and the health care that they're getting. And, you know, like the Veterans Administration is part of the war machine. It's part of the military industrial complex. It's like the United States fights wars. They invade countries. They send American servicemen and women into these countries to kill people. They send them in to capture resources and to oppress people. And in the two wars, Afghanistan and Iraq, about 2.5 million service people. I'll call them American GIs rather than say men and women, but American soldiers have actually fought in these two countries, 2.5 million. 700,000 have disabilities that the VA and the Department of Defense say they have, allow that they have. There are so many others that are not allowed, who have injuries or disabilities that are not officially recognized. And so 700,000 men and women have been disabled by the wars. And we know that the numbers for the Afghanis and Iraqi people are exponentially larger. But this is like the casualties that take place because of imperialism. It's reprehensible. It's totally unnecessary that these people must invade these countries and get killed and get hurt in the process. During the Vietnam War, they thought, or after the Vietnam War, they thought 15% of the veterans. And by the way, fewer GIs actually were in combat in Vietnam, which was a huge war, than there have been in Afghanistan and Iraq. There's 2.5 million in these two countries and 2.3 million in the Vietnam War. A horrendous war. So when these GIs came home, they allowed that 15% had PTSD. But actually, 25 years later, they found that 53% of all veterans who had fought in Vietnam have PTSD. In the wars in Afghanistan and Iraq, they say 1 in 5 is what they're admitting now have PTSD. And there's a new injury in these wars in Afghanistan and Iraq. And that is a traumatic brain injury, which is caused by one of the things that American soldiers are doing now, because it was urban warfare, and especially in Iraq, is they do something called breaking, and that's when they use these explosives to break down doors and go in and capture or kill people. And every time these explosions go off, it causes a TBI in the soldier's brain, but also in the people whose houses they're breaking into. I mean, these are horrendous injuries. And people, there are some soldiers in the Special Operations Unit who can have hundreds of TBIs. I was reading today about a soldier who had 7,000 over 5 tours of duty that they were able to calculate using, electronic, like something or other to see. And so and also the resistance, the IEDs, these improvised bombs that the resistance fighters are using because they lack the sophisticated bombs, etc., that the imperialists have, so they create these bombs out of artillery shells or anything that they can find. And so everybody is experiencing these TBIs. And so it's a TBI epidemic. It's being caused. It's like, in the Gulf War, we heard about the heavy, like the heavy metal, the spent uranium bombs. And they're still using those. But now it's something altogether different. These injuries that soldiers are coming home with. And so another aspect of PTSD there was only a glimmer of it in Vietnam and other wars, and this is MST. This is military sexual trauma, which we've talked about here in the meetings before. But MST, there's an epidemic of MST in the U.S. military. We know it's a patriarchal monster. That and in the article that that I wrote, 1 in 7, I'm not sure exactly what the number is, but it's horrendous. American female soldiers are sexually assaulted by American soldiers, usually of a higher rank, but not always. Not always. In these war zones, women are told, do not go to the latrine by yourself. Carry a knife. Carry your weapon, your pistol or your M16. Do not go to the bathroom by yourself. Have a battle buddy. Have another woman go with you, or a male friend. This is how women in these war zones are being coached, and have been for a decade, because their own comrades assault them. And the other part of this is that it's hard to get compensation anyway for PTSD through the military. But women are very much less reluctant, or less apt to file a charge for MST as an aspect of their own PTSD. They could have PTSD, they could have TBI, but as far as having MST as an aspect of their illness, they're reluctant to do it. And it's for an example, the Service Women's Network, which is an organization that supports women in the military, and one of their main aspects of work is MST. They say that of the tens of thousands of MSTs that the military acknowledges happens, only 13% are reported. There's a tremendous fear. And it's not only women, of course, because it's not always about that. It's about power. And so men are also sexually assaulted. Actually more than women, but because of the low numbers of women in the military. Up to 7% of all women in the military have experienced rape. And 1% of all men in the military have experienced rape by their own soldiers. So this is an example of this is the imperialist military. This is the monster that they've created that we send, I got to stop that, but that this country sends into Afghanistan, into Iraq, into Panama, all around the world, and almost every country in Africa, the special operations troops. I mean, this is the army that imperialism has created. When I was in the army in the 60s during the Vietnam War, there was a draft, and so I was drafted, and I resisted, and then I went into the army and organized for the American Servicemen's Union, and in my particular cases, I refused to go to Vietnam 3 times, and I got orders for Vietnam 3 times. I had 3 court-martials, and that's how I met the party. That's how I became a member of Workers' World. Is the party's support for me when I was in jail at Fort Dix, New Jersey, and others. And I would like to say, that there were thousands of us who resisted. I mean, tens of thousands. Like the stockade was full. It was 3 times fuller than it ought to have been. And I should say most of the prisoners are black and Latino. When I was at Fort Dix, there were Black Panthers, there were Young Lords. I was the communist, but there were a few of us there. But anyway, it was. I don't want to get off on that. I want to try to stick. I could really get off on that. But but also just another aspect of veterans' health care is that you have to have an honorable discharge in order to get it. You cannot get it if you've had a dishonorable discharge, or less than. It's kind of complicated, but if you don't have, if you have bad paper, as we say, you're not going to get these benefits as they are. Since 2001, combat veterans, there's been 100,000 combat veterans. These are people who've experienced combat, who are denied VA benefits for everything. If they're wounded, if they have PTSD, if they have TBI, if they have MST, if they have substance abuse problems, anything like that, they're denied care by the VA because they have a bad discharge. There's 100,000 of these. Another aspect, of course, it used to be that you, and I'm sure it still is, that you could get a less than honorable discharge for being gay, lesbian, transgender, bisexual. You could get a bad discharge, and you don't get health care. And after that is all said, only 37% of all veterans who are qualified even get health care. I mean, that's remarkable. Only 37%. Even though it's just, anyway, I don't want to. And so, and part of the aspect of the scandal too is that as I said, it's just like a sliver of ice above a deep ocean. Is that 10% of it is already, it's like every year more and more is privatized. It's the only public health care system in the country. It's the only publicly supported health care system for a large number of people, where you can go and you can, without insurance, and you can get a prescription for $9, and you can see a specialist for $40. But it's being chipped away, and part of the scandal is to show that it's not working. It's really not working, and so we need to get rid of it, and we need to privatize it. And John McCain is one of the people that's really pushing for this, as the Wall Street Journal and others are too, are pushing to do away with the VA as we know it, even as bad as it can be sometimes. We'd just like to maybe go on to the, to show that it's that even though all of these, like the PTSD, the battle wounds, all of that, these large numbers, 700,000 veterans with disabilities only from these last two wars. All of this huge system. I work with homeless veterans, and in New York City there are 2,000 on any given night. The other part I wanted to cover, I knew I was going to be getting this, but it's good, it's okay, is the disparities. And I do mention some of these in the article, so I won't go over them a lot, but there is in 2013 there was they have a 10-year study. Every 10 years they do this study, and this study showed that minorities and people in poverty had worse coverage in 2013. Had worse quality of health care and access to health care than they did in 2003. And the percentages are amazing. Well, they're not amazing to us because, like, we know them. The access to care is like 30 to 40% less for people of color than for white people. 60% less for poor people than for middle class people. These are people with median income. On 48 measures, poor people across the board, and only one measure did they even achieve 60% of what what the rest of the population. So it's like in Cuba, everybody gets health care. It costs $450 per person. This is a World Bank figure. This is not something we make up. In the United States, it's $9,000 per person, and we know where all that money goes. It goes to profits. If it costs $450 to have health care for every person, and it's quality health care that the Cuban doctors and the Cuban people export all over the world and provide at low cost for everybody. Here, it's about profit, of course. $9,000 when maybe it costs $450. Why would it cost any more here than it would there, actually? What is it? What's the cost? The cost is profits. I quoted one, health insurance profits raised 59%. I'm not sure which year that was, but anyway, I'm preaching to, I don't have to, it'd be nice to have the statistics, but they're available. There is an incredible amount of information available about the state of healthcare, and we've written a lot about it. Just that in Cuba there is one healthcare agency. There could be departments, but there's only one. In the United States, there's VA, there's the public health. Each state, each city, everybody's got one. And they're all competing, and hospitals in the same city are competing, for money. Sorry, I didn't give a rousing end, but I don't know. I think we're fighting. We know what we're fighting for. We want to fight for that $450 per person. That sounds reasonable. 9,000 is outrageous.